everybody. Taking off my mask so you can hear us better, but we are social distancing. So my name's Bianca and I'm here tonight with Dr. Richards, and we are going to talk all about dental implants. So welcome, thanks for joining us. So we'll go ahead and get started. So how are you doing, Dr. Richards?
Doing well, thanks.
Very
Hope
good.
you are.
Yes.
Just want everybody to take advantage of the information we're going to give you tonight and ask questions. We have a moderator here who will be taking those questions, so please, if you've got something you want to know, please ask us.
Yes. So we're going to kick things off with a video about the precautions we're taking with COVID-19.
Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Now's the time to get the smile you've always wanted. Call to learn about our specials and visit newteethnow.com.
So that's just a little bit about what we're doing to keep you and our staff safe here at the facility. And so we'll learn a little bit about Dr. Richards. So you are a board-certified oral and maxillofacial surgeon since 1982 with over 40 years of dental implant experience.
Right.
And you are the innovator of New Teeth Now.
One of them. Yes, ma'am. Yeah.
And so can you tell us a little bit about that evolution and how it's become to be what it is today?
Well, been an interesting evolution beginning in probably around 83, 82. My father was a general practitioner here in Lakeland, dentistry. And we did some of our first procedures back in the early 80s with fixed teeth on dental implants and made the teeth right away. One memorable fella, Bill Walker, who was a Snap-on tool salesman, he got a real big kick out of that, and I think he liked to take pictures around and show all his mechanic buddies what he had done. But we've done teeth in a day, teeth in a week, teeth in 3 days. We've done this particular procedure just about every way that it can be done. And what we are doing today, as you said, it's an evolution of about 40 years, really, of experimenting. And what we're doing now is, as you know, very reproducible.
Yes.
We get an excellent result every time. We see very few problems. It's incredible even to Dr. Kirkpatrick and me how well people do. So as we go through the webinar tonight, we hope to give you a lot of information pertaining particularly to full mouth reconstruction using dental implants and fixed bridge work.
First, we'll kind of see a visual of a fixed upper hybrid and what that looks like. Can you explain a bit about what they're seeing?
Yeah, these are non-removable, what we call fixed implant supported prosthetics. So you can't take them out. That's one thing everybody wants. They want something they can't take out. I heard that 12 times today from about 2 people. The second thing is the upper. Of course, that refers to the upper jaw. We do these for both upper and lower jaw. And then the third thing is hybrid. And that's a word everybody knows now pertaining to automobiles that run partially on gas and partially on electricity. So these hybrid restorations are such that they're suitable for people who've had a lot of bone loss. They're suitable for people where we're not able to put the implants exactly where the teeth need to go. So we put the implants where the bone is located, and then the teeth are made to go where the teeth need to go. And so since there is a sort of a disassociation between the position of the implants and the position of the teeth, it's sort of a hybrid type of a bridge versus a bridge where the implants are set specifically, very precisely, exactly where the tooth needs to go. That's more of like a crown and bridge type of a concept. So the hybrid concept is something that works for more people who have had significant bone loss, who don't have the best quality soft tissue, people who have been in traumatic events, car accidents, gunshot wounds, things of that nature. Anyway, if there are more questions about the specifics about a hybrid bridge, I can go into more detail.
And then here is what the lower looks like, so you can see that concept. And usually you place 4 or more on the lower as well, right?
Yeah, I mean, I usually put 6 in the top and 6 in the bottom, and of course, I always tell people you can't jam implants up. They have to be separated. As you see in this slide, they are separated. And so if there's enough room in the jaw to keep the implants separated and put in 5 or 6, then I do that.
Right.
The other thing about these prosthetics, this type of prosthesis, is that it is not cemented. It is screw retained. And so by virtue of that fact, it's easy to remove to clean. It's easy to remove to maintain should an edge of a tooth chip or something of that nature. They're very, very versatile and very easy to maintain.
Yes.
They also look wonderful.
They do.
When they're made out of zirconia and porcelain, they look unbelievable.
They really
and
do.
they also chew really well.
You wouldn't even know that they're not like natural teeth. And we did have a question. So what's the difference between like a SnapIn denture versus the hybrid?
Well, the SnapIn, first of all, this type of bridge you're seeing now on this slide, the fixed, that word fixed means that it does not come out. And as Bianca said, a SnapIn, of course, if it snaps in, that means it also snaps out. Therefore, it is removable. Mm-hmm. So the main difference is one is fixed, the other is removable. Beyond that, it's the materials that they're usually made of. Usually, at least in our practice here at New Teeth Now, the fixed hybrid restorations are zirconia porcelain, whereas most of the, quote, snap-ins are acrylic.
Right.
Which as you know, and as we talk about in these webinars, the acrylics just don't last.
Yes.
They're weak.
All right.
So I hope that answered that question.
Yeah. So we'll kind of go over what it looks like the day of surgery and the New Teeth Now procedure. So on the day of surgery, you'll come in early in the morning, be put under a deep sleep with general anesthesia, and it's a completely pain-free procedure because you are completely asleep. Then if you have teeth, they're first extracted, and Dr. Richards will place all of the implants that you need. And while you're still asleep, he will take impressions for the lab to customize the teeth. Then you'll wake up in a private recovery room, and as you're waking up, the in-house lab is fabricating those temporary teeth, and then those set of teeth are placed in the patient's mouth and adjusted before you would go home that day. So it's all done in one day.
This has been a big part of the evolution right here. Mm-hmm. Up until about 2013, we struggled with an outside commercial dental laboratory. And the volume of what we were doing just became so large that the outside commercial dental laboratory couldn't take care of us. So we had to do our own lab thing,
Yes.
which we did.
Yes.
Actually built a building and put our own full-service commercial dental laboratory, which primarily services our practice because we do 25 to 30 of these a month. We needed quality control. We needed to be able to do things quickly. We have a lot of out-of-town clients, and as you know, they can come stay for a week, but you got to get everything done. Mm-hmm. So a big part of the evolution and going from traditional 3-ring circus where you have the oral surgeon in one ring and you have the dentist in another ring and you got the lab in another ring and there's no connection between the rings. People are going all around and you have teeth going from the lab to the dentist and the lab to the surgeon. when we combine the rings, and then you have the intersection of the rings, that's where we're located. So we're located in a really good spot because we can do it all in one day, all in one office. So of this huge evolution over 40 years that we talked about, I think in addition to the parts and pieces and implants and coatings and all that stuff being better than it was in the 80s, this evolution of the business model and putting everything all under one roof is probably the most significant part of the evolution that has taken place.
Yeah, just so much better communication, and it's just more efficient and just a better outcome for the patient.
And you know, we have our own restorative dentist here, so at the end of the day, when the teeth are placed, if there are issues with the occlusion of the teeth, the bite, right. Dr. Dibbs is here. He can take care of it. I can take care of it with him. If he's seeing someone up in the prosthetic center and they have a little something going on that he has a question about, I can run up there. So and you'll hear Dr. Dibbs, I think, later in this webinar, and he'll address some of those issues. It's just all for the betterment of you, the patient, the client, that this business model came about.
Yeah. And here is our office building. So in the back there, that two-story structure is what Dr. Richards was referring to, where we had to build the lab, and now we have two operating rooms there as well. So we are a large family, a large team.
We are. We're, 50 strong here in this office, I think?
Yeah, something
like that.
Yeah. And of course, this procedure is all in benefit for our patients. And so we love to share their stories. And London is a really special individual who had this procedure done. So he was actually born with baby teeth, and he never actually grew adult teeth. So he wore a SnapIn smile, which didn't function well, and he had a lot of embarrassment growing up. So they searched for a very long time to find a surgeon who could do the procedure, and they finally found Dr. Richards. So we're gonna hear a bit about his story.
There's no fear now. These teeth are so strong and durable that I don't really worry now.
It just was nonstop hospitality. You wouldn't have thought you were at a dentist, I'll tell you that. You would have thought you were at a 5-star hotel.
So I first found out I had a problem with my teeth at around 3rd grade. And then I started to lose teeth around 4th grade. I was in the cafeteria and I took a bite out of my cheeseburger, and my teeth just came right out into the cheeseburger. And in front of my friends was this little insecure kid.
Being that insecure and self-conscious will affect you in so many different ways. Emotionally, physically, everything. It will affect you and it will change you.
And I went to dentist after dentist after dentist, and they told me, I'm sorry, we can't help you.
We've been to many, and never have I ever experienced anything like I've experienced with new teeth now.
The first time I met Dr. Richards, I had my doubts. I walked in there knowing that he's probably going to say, I'm sorry, we can't help you. But he didn't do that. He looked at me and he reminded me of how many patients that he's done with bone loss, and he assured me that he could get plenty of implants in with plenty of support and it wouldn't be an issue.
He made me feel so secure. I only met the man one time and knew that this is where we were going to go and who was going to perform this procedure on him.
And I almost felt like I was in a dream. Like, this is exactly what I've pictured ever since I was young. And he really just made me feel comfortable and just relieved that, it's possible for me.
From my perspective, you'll get traditional implants in the front, and you'll get some zygomatic implants in the back. We did one just about like this yesterday. You'll have a set of fixed teeth this afternoon without any bone grafting. You will not have to take those teeth in and out.
Oh my gosh. Oh, this is crazy. Oh, I don't even feel like I'm looking at me. Oh my gosh. Oh, this is so insane. Oh wow. I don't even know what to say. I just feel like there's a different person in the mirror. The biggest part about these is not being able to take them out, not having something that can come out. Because there's so many times in my life where, they've almost fallen out, and
that's all gone.
So I don't have to worry about that anymore.
Yeah.
I don't have to hide anything anymore.
sign of relief, joy, all the heartbreak and the heartache left in a sense. And all I felt was just gratitude.
This is always what I pictured, that there was going to be somewhere I'm going to go when I'm old enough, when I'm 18, and they were going to completely do my teeth and make the smile exactly how I imagined. And now that I have my teeth fixed, I feel like I have so much ahead of me. First things first is college, because this whole entire time I've been doing online classes up until I got my teeth fixed. And so I get to go into college with confidence and take my classes and make new friends and not have to worry about that. I can go to the basketball court and play basketball without any issues and not have to worry about them falling out, not have to put some type of glue that's super hard to clean out at the end of the day. This one is a really big deal. I went on a roller coaster the other day. I made sure to just smile through it and have my mouth open and just like let myself live like a little bit. And that's one of the biggest things, just that new confidence and not having to worry about them falling out and just experience life at like my fullest.
Our mission at New Teeth Now is to help patients overcome severe, long-term dental problems. We've helped thousands of people regain their health, happiness, and confidence, and we can help you too.
The teenager I knew had now suddenly blossomed into a confident, happy, secure young man.
New Teeth Now really did like change my life completely, and I just have so many plans for the future, so much hope again, and that's something I'm so excited to explore. Really.
So as you can see, we're so happy for London that he
Nice
could
kid.
begin his adulthood with confidence and a brand new smile, and he could eat, and so just really awesome. And I mean, he's also not like a typical patient either, because he's on the younger side, but he still had to get zygomatic implants, which we're going to talk about in a second. And a lot of times zygomatic implants are for older patients that have bone loss, and so that's more common. But we're going to go through the different types of implants and what they look like and who needs them. So you can take this part away from the technical side.
All right. Well, we have lots of different tools in our little tool bag here at New Teeth Now. We do a lot of different things. Both Dr. Kirkpatrick and I are oral and maxillofacial surgeons. We're used to navigating our way around the jawbones a lot. And we fix broken jawbones and face bones. And so putting these implants in is fairly simple for us. This slide shows just something that he and I do on an everyday basis that's just almost blindfolded, literally. These are just traditional implants, traditional diameter, traditional length. For us, this is the kind of a routine 6 on top, 5 on the bottom, set of screw-in teeth, top and bottom. These procedures take about 4 hours under general anesthesia. 2-3 hours to have the teeth prepared. By that time, the person's awake from general anesthesia. We put the teeth in at the end of the day around 4 o'clock, and they go home. So, you know, we do a lot of traditional implants, and that's a nice slide showing tilted implants to avoid the nerve, to avoid the sinus in the upper jaw, and we, you know, could show thousands of x-rays like that.
And then moving into zygomatic implants.
So zygomatic implants are confusing to a lot of people. And I know that because I talked to a person today and they were talking about, well, can we do zygomatic implants in my lower jaw? And I'm going, no, zygomatic implants are for the upper jaw. And let me tell you why. The word zygoma, Z-Y-G-O-M-A, is the cheekbones. It's your cheekbones right up here on your face, the prominence of your cheekbones. And you can see in this slide those long upper left last implant, upper right last implant are the zygomatic implants. So they are connected to the jawbone on the inside of the mouth, and into the zygoma bone up at the cheekbone. So they're very long. I put in 2 today. Dr. K put in 2 today. The ones I put in were 50 millimeters. They're 2 inches long. So they're very stable. They are the bone graft alternative. Bone graft alternative. If you have zygomatic implants, there is no bone graft. You do not have to wait for months to get your teeth. Zygomatic implants hold teeth the same day. So what you need to understand is they're for the upper jaw only. They're used when the sinus becomes a problem, when the sinus prevents the placement of traditional implants because the sinus either comes too far forward or too far down. Zygoma implants, they go into the cheekbones. They're for the upper jaw, and you can hook teeth to them the same day, no bone grafting. We've done, I don't know, 2,000 Zygoma implants, probably at least. Pretty steep learning curve. I feel bad for the people just getting into them right now. You know, you probably need to be doing 200 or 300 of them before you really kind of get the hang of it. But they work very well. We see few problems when you pick, you know, the right people, the right situation.
Yeah.
We use a lot of zygoma implants in our practice. This is a quad zygomatic picture. This is for upper jaw in the zygoma, okay, upper jaw only. They go in the cheekbone. Not only was there no bone in the back of the upper jaw, but there was no bone in the front of the upper jaw. Now this person had an unusual situation because there was enough bone to put a couple of 8 millimeter little short implants up in the front. So you take a person who's been around, it's not unusual, they come in, they've been for 3 or 4 other opinions, and they hear everything ranging from you don't have enough bone to do anything to we'll put you in the hospital and take bone out of your hip and bone graft you. They hear all sorts of stuff. It's going to take years to get their teeth.
Yeah.
And then somehow they find us. It's always curious to me how they find us. And we can do zygomatic implants in one day, and hook teeth to them in one day.
It's a total game. So this one's about recovery time. When will I be able to eat solid food again? When will I be able to eat steak?
Well, I would say recovery time before you would feel like jumping in your car and driving down to the store, 2 or 3 days. Most people take 3 or 4 prescription pain medications, and then they're on Tylenol or ibuprofen. Most people have some swelling that goes up for a couple of days and then down for a couple of days. And so I would say that 9.5 out of 10 people, I don't know where I get a half a person, but let's say 9 out of 10, not 9.5, have such a good experience, they come back and they say, Dr. Richards, you didn't lie to me when you told me I wasn't going to have trouble. And I say, you know, I can't explain it, but I ask every single person when they come in, you know, how many prescription pain pills did you take? The typical answer is 3 or 4. Mm-hmm. I go, how much discomfort did you have? The typical answer is, I didn't have that much. But occasionally we get a call from somebody and they say, I've taken all my pain pills, I'm dying. And I say, you need to get over here right now because I can fix that in about 5 minutes. And typically what it is that when the teeth are made out of acrylic, they're made out of hard plastic. So we screw the teeth in, just like we told you earlier. So they're screwed in. They are dead solid screwed in onto the implants. And if they are squishing the tissue, literally, pressing into the tissue so hard, they're just squeezing that tissue, then it hurts. Yeah. And as soon as that person comes back to the office and we unscrew the teeth, the relief is immediate and we just remove some of the plastic up on the gum side, put them back in, done deal.
Yep.
It's fixed. So, and I can tell you that from, the last 10 or 15 years of doing this. I mean, that's it. That's the bottom line. It works. And what I told you earlier about the level of discomfort and all that, that is just the way it is. It's the truth. Now, eating steak. Typically, it's not the implants that would be the limiting factor on eating. Typically, it's the teeth which are the limiting factor on eating. The teeth are made, I'm going to grab this, Roger. The teeth are made out of denture teeth. Remember, this is the first set of teeth, the, quote, temporary teeth. The teeth are denture teeth, and they're made with denture plastic. And you bite into something too hard, and these teeth can pop out of the plastic, or they can break. Now, I would say that most people don't have that problem. We tell them not to chew food that they can't cut with a fork, and most people do that. If we find a person who is breaking their teeth, then we make a second set of temporary teeth out of a stronger material that's a fiber reinforced material, and instead of having individual denture teeth set into plastic, the teeth that we make are milled out of a solid block. Now I'm going to show you this. This is a set of zirconia teeth milled out of a solid block. But the fiber reinforced acrylic teeth that are milled out of a solid block would look like this. The teeth and everything are all one piece, so there's nothing to break. So we can fix the continual broken tooth, and it's the teeth that typically would be the limiting factor on eating anything like Cuban bread, pizza crust, pork chop, anything you really gotta bear down in. Yeah. You just can't do that with the first set of teeth. You're gonna break them. The implants will be okay.
So that's a good point of why we do the temporaries and then why we place the zirconians after the implants have healed.
Well, we want everything to heal before we make the zirconia. This is a zirconia, and some people think that we order these things out of a catalog, and we have like a drawer of them up in the lab, and we just kind of pull them out of a drawer and fit them in their mouth, and I always find that amusing. This is a precision fitting device.
Yes.
It is custom made, and the fit and finish of one of these zirconia sets of teeth is just unbelievable. And so anyway, you clean them with a toothbrush and toothpaste and a water pick, and we don't make this. It's a 4-day job to make this little jewel right here. 1 day to mill it, 1 day to sinter it in a sintering oven, and then a couple days to put the porcelain on it. That's a 4-day job.
There are some questions about cleaning, so since you mentioned that.
Toothbrush, toothpaste, water pick. This is glazed porcelain. Stains do not stick to this easily. If they do, we can clean them. Yes. You don't get food stuck in between the teeth. You can, in some cases, get food wedged between the teeth and the gums, and that comes out easily with a water pick. So cleaning is not really an issue.
And then twice a year you'll get them. We recommend that you get them professionally cleaned as well, just to make sure every part is clean.
Yeah, the first year I think we like to see them a couple times, and then in yearly visits after that to check everything.
And then as far as the 6 months, so after you get the zirconias, that's the strongest set of teeth, then you can eat anything you want. Steak, pork chops, carrots, salad, all those things that you had to hold off on. You can eat anything.
Yeah, your diet's unlimited at that point.
Yeah, so they're even stronger than your natural teeth would be.
They would be very strong.
Yeah.
Yeah, let's talk about this for just a minute, because these are illustrations maybe easier for some people to understand. On the left is 4 zygomatic implants. In the middle is 4 zygomatic implants with 1 additional traditional implant right in the front. And then on the right is just like the x-ray, 4 with 2 traditionals. And so people are always amazed that they come over here and they've been told by 3 or 4 or 5 people that they can't have anything. And we look at their x-ray and start talking to them, and we're saying, yeah, well, we put in 4 zygomatics and maybe a couple others. There's other implant like that are called pterygoids that we do. And so you can take somebody that has no bone and put 6 implants in.
Yeah.
So, you know, go figure. You know, it's quite frankly the different, you know, if you wanted to have your heart valve, fella mentioned earlier had a heart valve. You know, if you want to have your mitral valve replaced, would you go to the surgeon that does one every day? Or would you go to the surgeon that does one a month? Or one every 2 months?
That's easy.
Yeah, it's easy. So, Dr. Kirkpatrick and I do one of these every day. This month, next month, last month, one every day each. One every day each. And so we get a lot of experience doing this. This is what we do. This is what our employees are geared to do. My surgical assistants, Dr. Kirkpatrick's surgical assistants, everybody who works here, this is what we're geared to do. This is what we do. This is what we are.
Yeah.
This is what we do every day. And if you want to have this done, you better come see us, because you'd be in the right place if you come see us.
I sure would.
So enough preaching.
And here's your team, actually. We're just talking about them. Nice new photo of your staff. So these are your assistants that help you out with surgery and, you know, all the follow-up care. And if you come and see Dr. Richards, these are the ladies that you'll also meet and work with.
And these are highly skilled young ladies. Highly skilled young ladies. They were taught by us, taught by me, taught by us. These ladies know more about dental implants than most dentists know about implants. I mean, they are so smart and so skilled at what they do. I couldn't do what I do without them. And, you know, what I wanted to say a while ago, and I kind of got off track, was, you know, we talked about the team concept and all that. Talk for just a minute. How many people does it take, how many people in this office does it take to pull this off for one person? How many does it take? The implant treatment coordinator, it takes Dr. Richards and his 3 people, that's 5. It takes Dr. Dibbs and Amanda, that's 7. It takes anesthesia and their anesthesia people, that's 9. And it takes Terry and Anna in the lab, that's 11. So to get a person through this procedure in a day in this office with everything that we have going on and our business model, it takes 11 people to pull this off. And we pull it off on 2 patients every day. 2 patients every day, and it works every time. We see very few problems. 11 people. How can some oral surgeon out in an office by himself, working with a lab that's 10 miles away and with a dentist, how they do this? I know, because I once did it that way, and it doesn't work that well, and it can be very frustrating. What we're doing now is fun, it's relaxed. We have a great relationship with our patients. They're happy, and it works every time.
Yes, I couldn't have said it better myself. And here's the anesthesia team. So Jack and Kim have over 30 and 25 years of anesthesia experience. So they definitely know what they're doing as far as keeping our patients safe and have the procedure done.
They do. Are there questions out there about general anesthesia?
No, we actually had one.
Because we get a few questions. You know, when we tell people we do these procedures under general anesthesia, and most people go, "Oh my gosh, I'm so glad to hear that. I just want to be awake. I don't want to know anything that's happening. I just want to wake up and it's done." Okay.
Yes.
That's what general anesthesia does. If you try to do these with some sort of IV sedation, it's not that fun, and I know that because I did that. I did that for years, and it can be not fun for the person having the work done as well as for the doctor doing the work. Not fun. General anesthesia, it's fun for everybody, particularly the patient, because
Yes.
it's like Jack or Kim is talking to them as they drift off, and then they wake up and it's all done. And it's 4 hours later.
Yep.
And it seemed like, boom. You know, most of you out there watching, maybe you've had a procedure and you've been under general anesthesia, and you know, you go out, you come back, boom, it's done. We get questions about, well, I'm old, you know, I'm sick, I got heart problems, or I've been smoking all this time, and, you know, my liver's bad. I mean, how do you guys do this in your office? Well, first of all, we get medical clearances on everybody. And so we don't do general anesthesia on everybody in our office. They have to have a medical clearance. We get their primary care physician and or pulmonologist, cardiologist, endocrinologist. We get lab work, cardiograms, we get everything. We here in this facility, we run it like an outpatient surgical center. So if you went out to a surgery center to have whatever done, they'd want a medical clearance if you got medical issues,
Yes.
lab work, cardiograms, the whole thing. We do the same thing here. And there are some people that we turn away for general anesthesia in our office, and there are some of those who elect to have it done in the hospital. So occasionally we do some of these procedures at Lakeland Regional Health Medical Center. So anesthesia is very important. I can't do what I do and do the anesthesia. So, you know, we've got the nurse anesthetist, and I can't say enough good about both Jack and Kim. I mean, they're just excellent at what they do.
Yes, they are.
It's wonderful for our patients to be able to have that service.
We also had a question about the sound of the teeth. So they're not like exactly like natural teeth, and they asked about the sound and when the new sound goes away. So I don't know if you have any thoughts about that, because I'm sure there are questions because they just feel different in your mouth.
Well, when people come in for a consult and they start asking me those questions, I have Terry come down. Terry is one of our head technicians who has had this. And so I usually have Terry come down and sit with the person. I've heard what Terry has to say. And Terry said by 3 months he forgot they weren't his teeth.
Right.
Certainly, you know, if you had all your teeth pulled and you had one of these babies put in there, one of these traditional old full dentures, big old chunk of plastic, if you had that put in your mouth, you'd know there was something in there. And you're stuck with it. And so, and it covers your entire palate, whereas this is a full upper zirconia. This is a traditional denture. So with the zirconia, the palate's completely open. It's relatively skinny. So the period of accommodation is not too long.
Right.
I can tell you that in the last 10 years, I know of only one person that I took care of who has still not accommodated to this. Mm-hmm. One person out of a lot. So, you know, when you're chewing, there's food between your teeth, and the teeth don't. Think about it when you're chewing tonight. Mm-hmm. When you're chewing, your teeth are not. I mean, if I go like that, I hear my teeth.
Yeah.
They're banging together. You got the enamel of the teeth banging together. If you have regular dentures and you do your jaws, you're going to hear the plastic. If you have the zirconia in there, you're going to hear it. But the fact is, when you're chewing, there's food in between your teeth, and so your teeth don't contact. So unless you're like running around like a duck, you know, going like that all the time, I mean, you're not going to hear noise. I mean, you're just not going to hear noise unless you run around banging your teeth together, which most people don't do.
Right.
You know.
So not a super
If
common
you do
problem.
that, if you're running around banging your teeth together, you got a separate problem, and you don't need us. You need somebody else. Go for therapy or something.
Gosh. All right. So we're going to talk, or we're going to hear from Dr. Dibbs about the dental lab and how they work together to achieve great outcomes.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. And we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So that was a great explanation of how we work so well together.
Yes.
Under one roof. And this is our in-house dental lab team. So it's quite a big group of people working every day, those master artisans creating your smiles.
And I couldn't do what I do for my patients without those people right there. Those are the unsung, behind the scenes. You typically never get to see them, but without them, once again, you know, they're an integral part of the team.
Yes.
You know, this is a team deal.
Yes, it is. And this image is comparing zirconia teeth to the acrylic teeth. So the zirconia teeth are sitting on top of the acrylic teeth, which are below, and you can see both of them have been worn for 5 years, and you can see the wear on the acrylic teeth. So they're stained, they're discolored, they're just not looking great. And the zirconia teeth look brand new. They're super shiny. They reflect natural light they reflect light like natural teeth do. So they're just an all-around like amazing choice that you would want for your final teeth. Just telling by that picture alone. And these are our implant coordinators. This is Shauna and Debbie. They started out as assistants, didn't they?
They did, yes,
So,
both of them.
Yeah, they've been with us for a very long time. They know everything there is to know about the procedure and what's involved, and so they're here to help you. That's the person you'll meet along with Dr. Richards at a consultation, and especially if you're out of state as well, they'll help you with planning and travel and logistics. So they are your go-to person throughout the process.
And if you call, they answer the phone, but you also answer the phone.
Yes.
Jason, you don't answer the phone anymore? How many other people answer the phone?
Well,
Nicole,
Mary, me. So there's like Lisa. There's at least 6.
plus these two, or
No, 6 including them.
All right, so
of ladies answering the phone.
So if you look at the team, okay, we just added 6 new team members.
Yeah.
Okay. And these are very important people because these are your first contact with our organization. Very important that you get a good first impression.
Yes.
And so we have 6 more, and what happens, you might talk to Bianca here, and you may make a decision to come here based on Bianca. But when you do come, you're going to see Shauna or Debbie.
Yes.
And then you would have a formal talk with a CAT scan with either me or Dr. Kirkpatrick and Shauna or Debbie, and we all sit down together and review everything and go through your treatment options. So that's how that works.
Yes.
But if you call here, you're going to speak to a fairly knowledgeable person who can give you a lot of information, but not all of it. Can't give you all of it.
Yeah, each
Until,
patient's different.
Yeah, until the scan and all that sort of stuff. So, and I know that all these ladies do a good job because I think in the last 2 or 3 months, the number of people who I have seen from out of the state of Florida has increased significantly. So I know that these ladies are doing a really good job.
Well, we try to answer as many questions as we can, so you're comfortable and ready to come in. So this is the CT scan. It's an open CT scan, and that's included in the consultation, where it's about an hour appointment where you'll come up with a treatment plan and finalize it, so you'll know exactly what will happen on the day of surgery, and all those details. And so we're going to look into a little bit of our patient transformations. So first up is Bruce. He's from Orlando, and he had a lot of pain, so he couldn't eat the foods that he loved, and now he can eat anything he wants. So that was his main concern, was all of that pain, and so no more pain. He can eat anything he wants. And here's Nathan. So he is a reptile trainer and wildlife conservationist. And his teeth problems begun actually from a facial injury from an alligator accident. And so he had constant oral pain where, well, you'll hear him talk about it kind of took over his life of just the pain that he was experiencing and degrading overall health from the periodontal disease. So we are going to see about his story.
When people are afraid, they freeze. So when you freeze up, that will get you killed in my industry. I mean, there's definitely a very, very healthy respect. I've been studying, behavior and all that stuff specifically with alligators and crocodiles and what I work with and train for almost 30 years. I'm not fearless, but I don't ever let fear in the room. One of only 2 times that I was bitten by an animal in my entire life. One of them happened to be square in the face. So I was doing gator wrestling shows, feeding demonstrations, all these different things, and I was kind of laying down on a dock similar to this, and I look over my shoulder and there's another alligator that was spooked by the activity and was already in the air. So as I turned to look over my shoulder to hear what the sound was, here I am turning my face right into a jumping alligator's mouth. And it was about 8 feet long and it clamped onto my face. Now you gotta keep in mind about an 8 to 9 foot alligator is gonna have well over 2,000–3,000 pounds of pressure per square inch in its jaws. So a nice good chomp is gonna do some damage. So it's slashed up through the cheek, kind of starting down here by the, almost the gum line really. Back over here, through the cheek, through the nose, broke my nose in a couple places. tooth pain, especially those exposed nerves. It was like this constant, non-stop, incessant pain, as if somebody had like a small little pen knife and just stuck it in there and would just kind of be twisting it.
You know, it started getting to a point to where it was affecting overall health. It wasn't just a, you know, appearance thing and then, you know, being a little self-conscious. I heard the ad come on the radio and I was like, huh, okay, well there's a option for a solution. Plus doing it in one day, I mean, you're not really out for the count for too long, work-wise and everything else. Anytime somebody tells you to count backwards from 10 and the next thing you know, you're waking up all like, what's going on? You know, and something new has happened. You know, it's a little, I guess nervous is probably the right word, but excited at the same time.
Drinks on me later.
Okay.
Doing the New Teeth Now experience. From when I got to the office at 7:30 in the morning to get prepped for surgery, that was like one of the best days off I've had in a long time. It was such an easy experience and it flowed so well.
Looks pretty good.
Looks like new teeth now.
Congratulations.
Thank you very
Yeah.
much, sir. Excellent work. New teeth now.
I married that man.
That's right.
I was excited to see how much energy I would actually have, like once my body wasn't trying to compensate for, you know, this crazy weird pain thing that was constantly going on. Right away that day, I think when I was coming out of the anesthesia and I was starting to really get my wits about me again, I mean, I could almost notice it right away, like, huh. It was like taking a deep breath of fresh air, like, whew, okay. I don't want to say I feel younger, but I feel younger again. You know, it's like the fountain of youth.
So he has an amazing story. He's a great guy. We had fun touring his facility and interviewing him. And so we did have another question come in. Can the shape, color, size, etc. of the teeth be customized?
Right. Well, a little while ago, I picked these zirconia teeth up, and I was saying that some people think that we just order these already made, and we have them in a cabinet, and we just kind of pull them out and show them to them, and they get to pick what they want. And that could not be farther from the truth. It's all custom made. The size of the teeth, the shape of the teeth, the color of the teeth, the color of the tissue, the fake tissue, if there is fake tissue, all of that is totally custom made for the person having the procedure. So there's nothing standardized. It's all custom.
Yeah, you can design all the aspects of it. We've had people bring in photos and say they want to look like their younger self, or you know, Terry in the lab, he wanted his to be a little bit crooked because he wanted them to look super natural.
Right.
So there's lots of ways to customize.
We love the 20-year-old photos.
Yeah. Sometimes those are hard to replicate. But all right, so we have a couple more patients. So this is Crystal. She had painful loose teeth and was tired of covering her mouth. But now she's laughing and smiling, talking to new people. It's just a whole different lifestyle for her socially. And then Gladys is from Tampa, and she had difficulty chewing and a lot of infection and was embarrassed. But now she is just beautiful and smiling and super confident. So, you know, those before and afters are just a great way to, show real life results in our patients. We have a lot of those. So I do encourage you to give us a call. If you have other questions, we can answer them. And then, we just want to see you in for a consultation if you're ready. So I encourage you to give us a call tomorrow and set one up. So thank you so much for tuning in with us tonight. We love talking with you all about dental implants. And if you have been with us, I think that this is probably something that you need, and so we just look forward to speaking with you.
Good night.
Good night, everybody.